8 out of 10 men will experience prostate enlargement as they get older. Most don't realize what's happening until their daily routine and sleep start getting disrupted. In this video, I'm going to explain how to recognize an enlarged prostate, how we diagnose it correctly, and all the legitimate ways to manage it, from simple daily changes to advanced treatments. Benign prostatic hyperplasia, or BPH, is a non-cancerous enlargement of the prostate. When the prostate grows, it squeezes the urethra, the tube that carries urine out of the body. That pressure weakens the urine stream and makes it harder to empty the bladder. If this continues without treatment, it can lead to infections, bladder stones, kidney damage, or even a complete inability to urinate. So, how can you tell if your prostate is getting bigger? One of the earliest signs appears when you urinate. The stream becomes slower, thinner, or stops and starts. Sometimes you have to strain to get started. You might feel a sudden urgency to go, take too many trips to the bathroom during the day, or wake up repeatedly at night. Occasionally, there can even be blood in the urine. Severe symptoms can progress to urine retention or kidney problems if ignored. To understand why this happens, think of the prostate like a small walnut that surrounds the urethra right where the bladder empties. In young adults, it's around 20 milliliters in size, but from around age 40 or 50 onward, it often starts to grow. What causes trouble is not just the increase in size, but the inward growth that pinches the urethra. And here is something important. The size of the prostate does not always match the severity of symptoms. A fairly small prostate can block a lot, while a very large one might bother a man very little. That's why each case must be evaluated individually. Let me share 2 quick examples. A healthy 50-year-old man had such a weak, interrupted stream that it really damaged his quality of life. His prostate measured only 35 milliliters. Medications weren't enough for him, so he chose surgery, and he improved dramatically. Another man, age 70, had almost no symptoms at all, but a giant prostate measuring 200 milliliters. After confirming no complications, we recommended only lifestyle changes and monitoring. Every patient is different, and the treatment must be tailored personally. Why does BPH happen? Age is the biggest factor. It's rare before 35 and extremely common later in life. Family history increases risk, especially if a close relative needed prostate surgery before age 60. Lifestyle also matters. Obesity, inactivity, smoking, and diets high in processed foods are linked to worse urinary symptoms. These factors influence hormone balance, including testosterone, estrogen, and especially DHT, dihydrotestosterone, which drives prostate growth. Healthy habits aren't a guarantee, but they can reduce severity and improve overall health. The symptoms men feel tend to fall into 3 patterns. First are the difficulties emptying the bladder, weak stream, difficulty starting, stopping, and starting, or straining. Second are bladder storage issues, urgency, frequency, and waking up multiple times at night. Third are the symptoms after finishing, like those extra drops that leak into the underwear even when you feel done. These patterns give clues about how the bladder and prostate are interacting. At the beginning, the bladder tries to help by squeezing harder, but over time the bladder muscle thickens and becomes overactive. This creates sudden urges and frequent trips to the bathroom. Eventually, the bladder may stop emptying fully. When urine stays behind, the bladder fills faster, nighttime waking increases, and that leftover urine raises the risk for infections and bladder stones. If the pressure keeps rising, it can push urine backward toward the kidneys and cause damage. Other problems can mimic these symptoms: urinary infections, prostatitis, bladder stones, kidney stones, certain bladder tumors, advanced prostate cancer, and even common cold or allergy medications can cause similar issues. That's why we always need a proper assessment before choosing a treatment. When someone comes to see me, I start with a conversation about symptoms and a physical exam, including a digital rectal exam to estimate prostate size and check for anything suspicious. I may order a PSA blood test not to diagnose BPH, but to screen for prostate cancer when appropriate. An ultrasound can measure the prostate and check the bladder and kidneys. And a simple test called uroflowmetry measures how fast the urine flows. Those findings together help determine the right plan. If symptoms are mild, lifestyle strategies can bring major relief. Drink plenty during the day, but reduce fluids before bedtime. If you wake up at night, avoid drinking again before going back to sleep. Some men notice that caffeine, alcohol, spicy foods, or smoking worsen urgency. Everyone reacts differently, so it helps to pay attention to personal triggers. If someone uses a diuretic medication for blood pressure, taking it earlier can reduce nighttime urination. Treating constipation, improving sleep habits, and taking time to fully empty the urethra by gently milking forward from behind the scrotum can help reduce post-urination drips. A lot of people ask me about natural supplements. Research is mixed, but some men do feel improvement. Saw palmetto, also known as Serenoa repens, at around 160 to 320 milligrams per day is the most common. Others sometimes tried include quercetin, pigum, nettle, beta-sitosterol, epilobium, lycopene, pumpkin seed extract, pollen extracts, and omega-3 fatty acids. They are not cures, and they may not work for everyone, so it's always best to discuss them first. When lifestyle changes aren't enough, medications can help. Alpha blockers like tamsulosin relax the muscle at the bladder outlet so urine flows more easily. They work within days, though some men notice dizziness or changes in ejaculation. Another group includes finasteride and dutasteride, which lower DHT and gradually shrink the prostate over months. They reduce the risk of worsening disease and surgery, but may affect libido or erections in some individuals. Tadalafil in a low daily dose can help both urinary symptoms and erectile function. And medications that calm the bladder like solifenacin, darifenacin, or mirabegron can help urgency and frequency. We often use combinations based on each person's needs. If symptoms remain severe, or if complications appear, like bladder stones, frequent infections, kidney damage, or urinary retention, then procedures are considered. These treatments remove or shrink only the inner enlarged part of the prostate, not the entire gland. TURP, or transurethral resection, of the prostate has been a standard and reliable operation for decades. Laser procedures such as holmium laser enucleation of the prostate can remove tissue with less bleeding and strong long-term results, though they require a specialist with proper training. Less invasive options include water vapor therapy, like Rezūm, and artery blocking techniques called embolization for certain individuals. Different methods suit different prostates and different patient priorities. A small number of removed tissue samples reveal a hidden cancer despite normal tests beforehand, so sending tissue to pathology can be very useful. After so many years treating this condition, my message is simple. Every man deserves a personalized approach. Some men do perfectly well with lifestyle guidance alone. Others benefit from medication, and many regain their comfort and sleep with a timely procedure rather than waiting for a crisis. The goal is always the same: better quality of life, safe bladder function, and long-term kidney health. If you see these symptoms in yourself or someone close to you, speak to a healthcare professional and get evaluated. You don't need to suffer in silence. A strong stream, peaceful nights, and confidence in your body are absolutely achievable. Thank you for staying with me until the end. Take care of yourself. Share this information with someone who may need it. And remember, your health deserves attention.